Thank you for joining us for the virtual continuation of Bridge Builders Conversations with Interesting People, presented by the Clinton Foundation and Colson Oil. My name is Stephanie Street, and I serve as the Executive Director of the Clinton Foundation. Tonight, we are joined by Dr. David Satcher, who will talk to us about his new book and his lifetime dedication to addressing health disparities in America. It's an incredibly timely topic, and we are honored he could be with us this evening. Our conversation will be moderated by Kevin Thurm, CEO of the Clinton Foundation. Kevin is one of the Clinton Foundation's most valuable assets. He is a skilled leader, he is strategic and results-driven. He creates a culture of unity and common purpose, and he truly values his colleagues, and it shows. We are very lucky to have Kevin at the helm. Kevin previously served at the U.S. Department of Health and Human Services in a number of roles during both the Clinton and Obama administrations. His role at HHS included senior counselor, chief of staff, deputy secretary under Secretary Donna Shalala. It was during his tenure at HHS that Kevin met and worked with Dr. Satcher, and I can't think of a more fitting moderator for tonight's conversation. And thank you all again for tuning in for what will be an incredibly important program. I'll now turn this over to my very capable colleague and friend, Kevin, to begin.
Well, Stephanie, thank you. Thank you for the incredibly kind and thoughtful introduction, and back at you about being a great colleague, partner, and friend. So thank you. Tonight, we are joined by Dr. David Satcher, the founding director and senior advisor of the Satcher Health Leadership Institute and a professor at Morehouse School of Medicine. Among other leadership roles, Dr. Satcher previously served as the Surgeon General of the United States during both the Clinton and George W. Bush administrations, as Assistant Secretary of Health from 1998 to 2001, as Director of the Centers for Disease Control and Prevention from 1993 to 1998, and as President of Meharry Medical College from 1982 to 1993. He is a lifelong leader for civil rights and health equity. His newest book, My Quest for Health Equity, Notes on Learning While Leading, which I have here, was published in September. I've read Dr. Satcher's book, very much enjoyed it, and we'll ask a number of questions from it this evening. Full disclosure, as Stephanie said, Dr. Satcher and I go back a few years. We worked together at the United States Department of Health and Human Services during the Clinton administration. It was genuinely an honor to work alongside him, just as it is an honor to be hosting this conversation this evening. One of his rallying cries is, quote, "to make public health work like it's never worked before." It is a noble pursuit, especially with Dr. Satcher leading the charge. We have many thoughtful questions that were submitted by our guests tonight, and I'm looking forward to getting through as many of them as possible. So let's get started. First, let me start with a basic question. Can you help us to level set for our session? You've spent much of your professional career dedicated to pursuing health equity and fighting against health disparities. Could you provide a definition for us of public health?
Well, thank you, Kevin. It's really great to be with you after all these years. But so you're going to have to ask your question again. I had to get that part out.
I appreciate that. I think it would be useful for us to level set and for you to give a definition of public health to the audience, because it's really the foundation of the conversation we're going to have over the course of the evening.
Well, public health is the discipline that deals with the health of the population. And I like to say that it is the collective efforts of a society to create the conditions in which people can be healthy. I forget who said that first, but I like that definition. And so I used to throw that in.
What is it about that definition, Dr. Satcher, that you like? What's the element of it that really resonates for you?
Well, there are two things in there. One is the collective efforts of a society. And that's critical. I mean, a society has to be able and willing to work together across racial and other lines in order to create a successful public health system. And the conditions, much of what we deal with every day is with conditions. How can we improve the conditions in which people live? And of course, as you know, for some people, the conditions are better than others. So we talk about the social determinants of health. We're actually talking about the conditions. And some children grow up in communities where there's no safe place to play. There are other children who grow up in communities where they don't have access to good nutrition. And for them, school is the only experience they have with very good nutrition. So I think these conditions are really critical.
You write in the book about one of the chapters, it's about the epidemic of childhood obesity. And your references to children and the social determinants of health. I think that would be an interesting example for us to just start as you frame, as you talk about conditions and the social determinants and how it's not equal for all children.
That's exactly right. And I think that's the real struggle that we face in public health. It's how can we begin to change the conditions under which children are born and reared in this country so that children have an equal chance of succeeding in life. And it's not an easy task, but it's a very critical one. We need to do a better job of creating healthy conditions or healthful conditions for the children that are growing up. Without those conditions, many children are not going to be successful because it takes certain conditions to allow children to be successful. That's what the report on childhood obesity was about. And by the same token, that's what the report on youth violence prevention was about. It was about how can we create the conditions which we need in order for children to succeed.
And one last example before I pivot. In that chapter, you talked about while some states would require physical activity for children, not all schools either had physical activity as a requirement, and for many children, they didn't live in communities where there were playgrounds, where there were that were safe to go to, or there were fields. Mm-hmm. And I think that was a really good example, as you said, about the unequal conditions leading to disparate outcomes.
Kevin, one of the advantages that I had in terms of having been director of the CDC was that I had an opportunity to really look at several of these issues before. It was when I was director of the CDC that we reported that over the last 10 years, the percentage of schools requiring physical education K through 12 had dropped from like 50% to 29%. And so we worked with the Surgeon General at the time, Dr. Audrey Manley, whom you remember, and there was a report on physical activity that we did. So I had an opportunity when I became Surgeon General to follow up on that, and that was very important for the Surgeon General's report on childhood obesity.
So I want to take the first question, go to the first question from our audience, which I think will help us dig a little bit deeper into the inequities. So this question comes from Derek Lewis, and building on what we've talked about, he asked, how does systemic racism impact the public health system?
Well, systemic racism is critical in order to have the kind of public health system which I tried to define in defining public health as a collective effort of a society to create the conditions in which people can be healthy. you have to have an involvement of all segments of the society. And by the same token, we must be responsive to the needs of all segments. I'll say one thing about the Satcher Health Leadership Institute here, and this is where I am right now as we speak at the Morehouse School of Medicine. One of our programs, and I'm sort of biased toward this program, I think it's our most important one, is the program of parenting. We take 15 to 20 young parents every year, and they go through a program of quality parenting, in which they learn a lot about what are the most important aspects of parenting if we want our children to be successful, healthy and successful. So that program has been going on now for almost 10 years, and I think it's made a tremendous difference in the community.
One of the things you write about the parenting program, as I recall, is that when you talk about leadership, that individual parents sometimes don't understand that they are leaders, and they're leaders for their children, they're leaders for their families, and leaders in their community. And maybe you could talk a little bit about the role of parents as leaders in collective action to drive improvements in public health.
You know, parents may well be the most important leaders. We have, in addition to our parenting program, we have a program for pastors in the community, and the response has been amazing. We have program for mayors, because as you know, mayors often bear a major responsibility for dealing with violence in the community, creating safe environments. But the problem is, are we prepared to work together as a team? Those of us in medicine, public health, do we know enough about what mayors go through? Do they know enough about what we go through and what we have to offer? So we have a program that's now graduated over 50 mayors and funded for the most part by the Casey Foundation, I believe. So it's been a very interesting program, and people have a lot to learn and a lot to teach each other. And so I think that's what we've tried to build on.
Well, that's great. I want to build off that question I asked you and give the audience a little bit of a sense of your background. I want to go back to your book. You write about the conditions in which you were born. You were born in Anniston, Alabama, in the segregated South. And at the age of 2, you contracted whooping cough, which led to pneumonia and difficulty breathing. And at the time, and you write movingly about this, because you're Black, you would not be admitted to a local hospital. And you write that this experience helped you to understand that health is not equally distributed. And I think it would be useful if you could help explain how this experience impacted you and your career, and how it helped you to understand health disparities.
I have to introduce another character in order to really explain that. There was a physician by the name of Dr. Jackson. He was the only Black physician in the area. And my dad convinced him to come out to the farm to see me on his off day. And he spent all day there working with me. But before he left, he told my parents that he didn't expect me to live. Now, he didn't expect me to live, but he couldn't admit me to the hospital, because that's just the way things were. And people got used to things being that way, unfortunately. But anyway, Dr. Jackson spent a lot of time, and he left, and my mom must have done a great job in terms of what he had said that they needed to do. She spent a lot of nights up with me all night, according to my sister. And sometimes she even breathed for me. And she didn't talk much about that later in life, but my sister always did. And when I graduated from medical school, my mom was sitting right near the front row because she had been told that I probably wouldn't live. And she was quite proud that I not only lived, but that I was going to help others to live.
Great. No, thank you for sharing it, and it's a really compelling part of the book. You also write about the importance of leadership and leaders as role models, and you write about your parents being your first inspirational leadership role models. And I think it would be great if you could, in addition to what you have commented about your mom, talk a little bit about your parents as well.
I'd be happy to, because my parents were special people. Neither one of them graduated from elementary school. My mom went to the 5th grade. My dad dropped out in the 1st grade. He had a very difficult home situation, including his father being an alcoholic. But anyway, they were very good parents. Somehow they found each other and made a great home. Somehow my dad saved money and bought a 40-acre farm. And we grew up working on that farm. And everybody had a job. And I remember when my job was to take water to the fields to my older siblings, or just to feed the chickens. I think about John Lewis's story. I actually did have that experience of being responsible for feeding the chickens and then milking the cow. So by the time I was in high school, I knew how to do a lot of things. And my parents believed very strongly that you cannot, as they put it, you cannot expect what you do not inspect. So they monitored very closely our work. But also, I must say, I was very fortunate. There were 9 of us, and my older siblings were great role models. We had to use your problems of siblings, but they were very great role models and responsible people.
And I ask in part because the confluence of it's dramatic for me, as I was reading the book, about the conditions that existed at the time and the systemic racism and how it impacted and really, as you describe tonight in the book, threatened your life at a young age, and the extraordinary leadership of your parents, and as you comment, your siblings, in providing early lessons that you carried forward through the rest of your career and your life. So I'm going to come back to that, but for the moment, I'm going to transition for a moment. We have a number of people in the medical field who are in the audience with us this evening. And Dr. Jane Myers submitted this question. What's the most important thing a physician can do to support health equity? And then more generally, how do frontline healthcare workers play a role in the process of achieving health equity?
Well, one thing that a physician can do to promote health equity is to treat patients equitably. And even in an environment like Anderson, Alabama, because there were some physicians who did not see Black patients at all, there were others who saw them, but they had to wait outside until everybody else was seen. So that's an example, and maybe that's an extreme example of where physicians allowed their patients to be treated in a way that was not fair. Dr. Jackson, of course, obviously is a role model. I didn't tell the rest of his story. I wanted to go meet him. So my parents promised me that for my 5th birthday, they were going to take me to town to meet Dr. Jackson. I was really excited, couldn't wait. I never met him. He died that year, and I will always remember him because by the end of that year, I was saying I'm going to be a doctor like Dr. Jackson. Couldn't meet him, after the way I wanted to, but he became a major force in my life because I had never met anybody who had finished high school at that time, before I made that decision to be a physician like Dr. Jackson.
I want to draw you out in this moment, other ways in which frontline physicians, healthcare workers could be have a positive impact on health equity. What are the additional ways in which you think that works?
Number one, I think that physicians can be role models in their own offices when it comes to treating patients, and to make sure that patients are treated equitably and with caring. We like to say that we need leaders who first care enough, but we also need leaders who know enough, leaders who have the courage to do enough, and leaders who will persevere until the job is done. We certainly need more physicians who provide that kind of leadership and who themselves become positive role models. For some reason, people expect more of physicians. So even if you're in an environment that's not built on equality, it doesn't stop you from being a role model for that. And some physicians demonstrated that. Many of them didn't, of course, in the Deep South. So I think there are a lot of opportunities. The first and foremost, physicians have a responsibility to treat their patients equitably and to provide the quality care to every patient and to treat them with dignity.
And is that part of the ethos of what students who are going to Morehouse School of Medicine are getting as part of leadership training?
Yeah, and I'm glad you asked that question, because this is an amazing institution. A long history, which I won't tell, but the president here is Dr. Valerie Montgomery Rice, and really committed to health equity. That's the major theme of this institution. When students apply to this institution, that's one of the issues that's always brought up is, are you committed to health equity? So I think health equity runs through the veins of this institution, and it didn't just start. I mean, the institution is about 45 years old, but it has a long history already of providing equitable treatment for example, I don't know of any other medical school where every one of its faculty members are tutoring some student over at the Tuskegee Academy. So the school has acknowledged that there are a lot of students who will never make it to medical school or nursing school or physician assistant training unless they're provided some support early in life. Because they grow up in an environment where their parents are not necessarily able to give them that kind of support. So I feel very good about this school, this environment, this commitment that the school has made very early.
That's great. Well, we're going to come back to that. I want to broaden the conversation a little bit to going back 25 years ago, where we met in the Department of Health and Human Services, and to the Clinton administration. And as I mentioned to the audience earlier, we both worked at the department, and you served as the head of the Centers for Disease Control and Prevention during a good part of the Clinton administration.
Mm-hmm, yes.
And I know the CDC has been in the public eye in ways over the last 7 or 8 months that it typically is not. But I think it would be useful if you could help the audience understand the historic role of the CDC and offer an example of its exceptionalism from your tenure as leader of it.
There are two things that I will mention, and you may want me to go further. But very early after I became director of the CDC, and that was 1993, I had been president of Meharry for almost 12 years before that. But not too long after I became director, I received a report from a commission that had been set up about Tuskegee. And I had read something about Tuskegee, I believe in 1972 when the first articles came out. And it was about the 400 plus Black men who were involved in a study thinking that they were being treated for syphilis, but they were only being observed so that they could learn. And the Public Health Service was responsible for this study. So the commission submitted this report to me. I forget exactly when it was, but I know that very soon after that, I called Secretary Shalala and told her about this report. And we talked about it, and it was the same day, it may have been in the evening, that she called the White House to tell President Clinton about this report. And the commission had recommended that the president make an apology on behalf of the American people for the treatment that these men had received. Most of them were deceased by that time. And President Clinton immediately said, yes, we got to do this. And so I think it was May 16th, 1997, in the East Room of the White House, that President Clinton issued the apology for the Tuskegee study. It was quite a moving event. I never will forget it. President Clinton was very caring, but also very frank. He said, now we need you to do something. He said, we really need more African Americans to be involved in research studies, even though you had this experience. If we're going to solve the problems of medical care and health in this country, we need you to participate in the research that we're doing. However, we believe that communities should have more to say about how they're treated and be in a position to monitor how they're treated. I never will forget that day. It was quite an amazing day when President Clinton made that apology. And so it's a lot of things have happened since then, but I think that apology was sort of a turning point in that here was a president of a country apologizing to a group of people for the way they were treated and doing it really sincerely. So it had a tremendous impact on me, and I never will forget it.
And I know, and I'll come back to the CDC in a second, but I know there's great concern in this country prospectively about if and when a vaccine for COVID is developed, or vaccines, plural, are developed and approved by the FDA, whether certain communities will take the vaccine. And I know there's significant concern about Black communities and whether people will be willing to take the vaccine. And this thread of concern goes back. I mean, obviously Tuskegee was a seminal event, but it goes back before that, and other examples of ways in which the United States government and society created, back to the social determinants of health, these inequities. And be interested in your thoughts about this challenge if and when we get vaccines for COVID.
Yeah. First, let me say, as director of the CDC, one of my major challenges was getting childhood immunizations up in the Black community. It was a real problem. I remember specifically, for example, Detroit had a childhood immunization rate of like 29%. Vermont as a state had a 70%. And obviously the racial balance had a lot to do with it. So the struggle was knowing that the fact that these kids really needed to be immunized. And yet there were all kinds of concerns about trust, just as we have some of them now. But what we did, and I'm sort of proud of the experience that we had, we decided to develop a partnership with the National Council of Black Churches. And so many of the churches agreed to work with us. Many of them provided spaces in the church for kids to be immunized. And we were able to get immunization rates in this country up into the low 80 percentiles. And I say that because we're facing that kind of challenge today, I think, when it comes to a vaccine for COVID-19. it's not going to be easy for us to, because we've had trouble getting participation in the trials, even though we've had some success recently. We got to keep pushing that, and we've got to make sure that once the vaccine is ready, that people can trust it to be in their best interest. I think we're moving in that direction.
And just to go back to that moment, the Clinton administration, President Clinton and Secretary Solala, pushed forward the Vaccine for Children's program,
Right.
which was an important programmatic aspect to offering at no cost vaccines to children who either weren't they weren't being covered by Medicaid or other programs, and in a way have the program, people may be reluctant to take it. So the importance of the partnerships with trusted actors in the community, because even the best designed programs are unlikely to work without those elements of the building the confidence.
Yeah, I can tell you remember that in detail. That was a great experience. It really was. The partnerships paid off and gave me a lot of satisfaction and confidence that we were able to do that together. I remember Detroit had one of the lowest immunization rates in the country, I think 20-something%. When this was all over, we decided to give Detroit an award because they had the greatest increase in immunization rates. And so I went to Detroit and presented the mayor with this award for the success that they had experienced. And it was a great experience. I can't think of anything better that you can do for children than to get them immunized. And I remember, I won't get in this in depth now, but I remember going to India, and we were, the CDC you asked about its global impact, and CDC was involved with trying to get children immunized all over the world. And so India was one of the countries where polio was still a problem. There was also Nigeria, Afghanistan, and we had decided, the CDC had decided that just as we were involved in the eradication of smallpox, that we were that close to eradicating polio, and we were going to push to do that. I remember spending a week in India, and we immunized 100 million children in India that week. And that's the kind of thing the CDC did. And that was the kind of thing that people expected and appreciated about its leadership role. It was, there was the WHO, and the WHO and the CDC worked together, a lot of respect, great partnership, and a lot of accomplishments.
Indeed, including essentially over time, the eradication of polio. To the Detroit illustration, you were the first Black director of the CDC. You also hired the first woman as deputy director, Dr. Claire Broom, as I recall.
Right.
And you talk, you write in the book about the importance in leadership teams of, I'm going to say diversity, but it's more complex than that, because it's not just about objective characteristics. It's about experiences. It's about working together as a team. And I'd be interested if you had thoughts about that, either in the CDC experience or other teams that you've built.
Yeah, it's one of the most important experiences that I've had throughout my career. It's one thing, we skipped a lot of my career in terms of the student movement here in Atlanta and going to jail during those early 60s. But I think I did come to appreciate the importance of diversity and importance of making sure that people had equal opportunities to succeed. Claire Broom was just a brilliant person, brilliant scientist, had done some outstanding work before I got to the CDC, but no woman had ever been a deputy director or anything that high. So she was the first, and she did a great job. As you remember, Helene Gale later became head of the AIDS Institute. So we had a lot of great things happen because we were committed to diversity.
Yeah, well, and we did skip part of your narrative, but I want people to buy the book, so I'm not going to unpack the whole thing. I can't unpack the whole thing, but it is a compelling narrative about you going to college, and you should jump in. You write movingly about, I think, if I recall, you were the only Black student in your medical school class at Case Western. As well, and you were molded by leadership experiences you had as a college student at Morehouse.
Yes.
As well. But I want people in the audience to go and buy the book. We may have time to come back to it as well.
Kevin,
But if you want to add anything, David.
Too. Go ahead. I'm sorry.
No, but you should. I want to invite you to reflect on that, and then I'm gonna turn back to current events.
Yeah,
okay.
I'll make it brief. I came out of Alabama. I had been through a lot, of course, and I got the opportunity as a student at Morehouse to really join a movement in which we were resisting racism. It wasn't very safe to resist racism, so getting together with a group of people, making a commitment to nonviolence. And I often say that one of the great things about nonviolence was, number one, the discipline that it involved. The students made a decision about what we would do and what we wouldn't do. And we knew what to expect from everybody who was in that line or on that team, because nobody was going to surprise us by starting a fire or throwing a rock or whatever. So it was a close-knit group. And we supported each other, but we were prepared for things that were going to happen to us. And we had already decided that we weren't going to return violence for violence. I have great memories because it required a lot of discipline. I took my books to jail with me. Students used to laugh about that, but I did because my first priority was to go to medical school still. And so I took my books to jail with me, and I did well academically while getting arrested.
Well, there may be a lot of youth in the audience tonight. We're not necessarily saying that's the only path forward to take your books with you.
That's right.
But it's a path. But it's a path that worked at a moment in time for which the issues were so dramatic, and genuinely for people who have an opportunity to read it as a compelling personal narrative around who you spent time with when you were an undergraduate. I know some of the people like Marion Wright, now Marion Wright Edelman, and others who inspired you and were part of that group. Really compelling narrative, and how the importance of peer groups back to the Satcher Institute, which is who are these people who come together, because leadership takes all sorts of shapes and sizes.
That's right. No, it was quite an experience. Yeah. And I remember the first day I saw and then met Marion Wright Edelman. She was Marion Wright. She was a sophomore at Spelman. She was outstanding even then. It was clear that she was going to be a leader. And as you know, she went on to be the first African-American to pass the bar in Mississippi, and then on. And she started the Children's Defense Fund. And it's been one of the most successful groups in Washington, advocating for children and health.
Yeah, no, indeed. I want to pivot back to COVID-19 for the moment. We are, I don't know if it's the second phase or the third spike of the first phase, but we have rising rates and positivity in quite a number of states, and a number of questions had to do with the pandemic. And several questions from the audience were, why are we seeing the higher rates of infection and fatality in communities of color?
Well, that's a very important question. And I say that because, as you know, during our time in Washington, we made the elimination of disparities in health a priority. It was, in fact, a morning in the year 2000, I got up to go out walking and was surprised that there was 6 inches of snow on the ground. And then I turned on the radio and they said that the government was going to be closed. We had more than 2,000 people who had come to Washington. They were in hotels waiting for us to release Healthy People 2010. It was amazing. And so I called the secretary, Donna Shalala, and told her about this dilemma that I really had all these people, even people from out of the country, like the Minister of Health from Uruguay and Egypt were there. So I really didn't want to cancel the release of this report. And Secretary Shalala agreed that we should go forward. And so on that day, when the government was closed, we released Healthy People 2010, and it became a driving force in our life and our work.
I want to pause for a second. I'm going to come back to the original question. Because you said just before the importance of committing to eliminate the disparities, and you tell in your book the importance of driving people from saying reducing the disparities to eliminating the disparities. You'd be interested in your reflections on why that difference was important.
That's very important. So I appreciate your bringing that to the fore. Prior to that, we had talked about reducing disparities in health. And it was easy to say in a way, but it was not measurable. We just said reducing disparities in health. So we decided to make a commitment to eliminating disparities, regardless of how long it took. And so in January 2000, in Healthy People 2010, for the very first time, we used eliminate disparities in health. And we set out to do that. Excuse me, Egypt did the same thing, Uruguay, because their ministers were there to really see how we were going to handle that. So yeah, language is very important. And that language, of course, committed us to eliminating disparities in health. And I think that commitment alone is very important. It started us on a path, hopefully, that we will never get off of, to eliminate disparities in health and to supporting programs geared toward doing that.
And one contextual point, so Healthy People 2010 and the Healthy People series sets out objectives that the federal government commits itself to with partners to achieve certain things and the elimination of these disparities. So now it brings me back to the underlying social determinants of health that are driving disparities in positivity rates and fatalities in communities in the United States. And I'd be interested in your further reflections on the things that are driving that for the Black community and the Latino community, the Native American communities, for example.
Yeah, and I was going to say that I never really appreciated that until later, but I'm not sure I fully appreciate it now. But the World Health Organization asked me to serve on a commission, and the purpose was to look at social determinants of health. And we traveled all over the world looking at how different countries were impacted by disparities. And so we ended up doing a report on the social determinants of health, the conditions in which people live. We're back to the conditions again, the conditions in which people live and how those conditions impacted their health. So as a result of that, a lot of things happen. Now, as you know, recently, Daniel Dawes has released a book on the political determinants of health. And that's so important because I think the social determinants of health leading us closer to basic causes of disparities. And so understanding, as I said before about children, living in communities where they don't have access to safe places to play or to grocery stores where they can get foods that are nutritious. all of these things sort of come together. And I think we're moving in the right direction. We've just got to make sure that we continue until we get there.
You referenced that Dr. Dawes coining the political determinants of health. You've talked about some of the social determinants of health. What observations do you have about and channeling Dr. Dawes and perhaps about the political determinants of health and how important they are?
Well, you know more about this than I do, but let me just say, politics is a very important part of our lives. There's one chapter in my book on science, policy, and practice, and it recognizes that ultimately it's what we do, it's how we practice, not just in medicine, but in government. You know, how do we deal with the social issues that are impacting people's lives? You know, how do we deal with poverty? How do we deal with violence? Those are all factors that we have to be willing to take on if we're serious about eliminating disparities in health. So I've appreciated the opportunity to observe the unfolding of these issues. And but I spent 5 years working with WHO on the social determinants of health. Then we released our report in 2009, I believe it was. So it gets back to your question about, you know, what is public health? And public health is evolving, but clearly we have a responsibility to populations. And, you know, as you watch the evolution, populations keep spreading and getting larger. And we become citizens of larger and larger groups of people and places. And I meant to point out earlier that when we set out to eradicate polio, we ended up, there were only 3 countries left, I believe, where polio was still a problem. And that was, those were Nigeria, Afghanistan, and Pakistan. And so when we set out to immunize children in those 3 countries, we ended up with only 2 countries where there was still polio, and that was Afghanistan and Pakistan. The problem there was we couldn't get vaccine to the children because of the fighting. In other words, so war is a deterrent to health in many ways.
I want to, it's not often that people, or not every day that people have an opportunity to hear from someone who served as the United States Surgeon General. You know, what was a day like for you? You've had any number of leadership roles. When you were the Surgeon General of the United States, you were the leader of the Commission Corps, and in addition to the other roles you had. And what was a day like, a typical day, or what did you like about that opportunity when you had it?
Well, I enjoyed it. I have to say it was hard work, you know, which it should have been, but I had some great people around me. You remember Ken Matsuga, who was my deputy, but I had a lot of people like that who were really committed and who did great work. You know, a day that I remember, and I'm sure you do too, is 9/11. I was on my way to the airport. I was supposed to speak that evening at Princeton and then catch a plane and go to Uruguay. I had promised the Minister of Health that I would come to Uruguay for their announcement of their plans and goals. So it was quite an experience. That was one day. You get up early, you catch a plane, you go somewhere and speak. Or on other days, of course, you work with your staff there in the facility. But the Surgeon General's job is one of the most exciting jobs, I think, in government. I enjoyed it. It was busy. You're always traveling, always moving. But I had some great people around me. One of the people, by the way, Kevin, you might remember, who died on 9/11 was Paul Ambrose, who, he was a physician. He had finished his family practice residency at Dartmouth and had come to work with me on the child obesity report. And on that particular day, Paul Ambrose was on his way to California to a pediatric obesity conference. And he was on flight 93, I believe. You know, flight 93 ended up crashing into the Pentagon. Yeah, that was a tough day. That was one of the most difficult days of my life and certainly my tenure. All of the days were challenging, but I was surrounded by really good people, and that made it very interesting.
Yeah. Well, as we're nearing the end of our time, I want to ask you what is always the final question for our Bridge Builders program. Each person who speaks is invited to offer a call to action. So a charge to each person in attendance to learn more or to do something that adds to the bridge that together we're building to the future. So Dr. Satcher, what's your call to action for our audience tonight?
Well, I think it's time for each of us to see it as a personal responsibility when it comes to eliminating disparities in health. It's going to take that kind of attitude for us to succeed. And there's one more story in the book that I don't know if you remember the medical school story at Case Western, when I walked out on the experience because of the way that Black patients were being treated in this service. And they threatened to put me out of school. But what I did wrong, and I didn't recognize that until much later, was that I walked out. There were 9 students on a rotation. I was the only Black student. But if I had to do it again, I would have talked to those students about our doing something together. So I try to make that point in there, that sometimes maybe my background in the civil rights movement, it leads me to jump to conclusions about who will do what. But I certainly believe that, and I said it later, that I could have handled that in a better way, as opposed to thinking I had to do it all myself. I could have rallied the troops. It was later on in leadership that I learned the importance of that.
So, because you've told the story, your fellow students were with you.
Yeah, the next
right?
morning they all walked out. You know who
And
told
you
me
might
that?
want to say, just in brief, what was going on in that room in a way that kind of stood up for you, that got you to do that, and the other students to also do it as well.
Well, that was before the Medicaid was fully implemented, and patients who couldn't pay knew that they had to be involved in the training of students and residents. And they, but some of the people there didn't treat those patients with respect. We've had to deal with that at other times. So when we walked into the room that morning for the first day of OBGYN, the first thing was, these are 4 Black women who were up in stirrups without curtains. And I thought it was a terrible scene. So that's what led me to walk out. And as I walked out, of course, the director of the program threatened to make sure that I was going to be put out of school and not get into any other medical school. You remember that whenever anybody says something like that, when you worked so hard. But anyway, the next morning I went to see the dean, who was Fred Robbins, Nobel laureate in developing oral vaccines for polio. And when I went to see him, he was smiling, and I couldn't figure out, why is he smiling? But you have to know Fred. Anyway, he told me that the other students had walked out that morning, and that he says, David, we're going to fix that program. And it was the beginning. And then the nurses, until this day, there is a program which they named for me, which allows them to attract underrepresented minorities to a 3-month training segment. They have, somebody said that the Black faculty representation at Case Western has increased tenfold since they started that. But the point I wanted to make, and I stray from it, is that I had allies that I didn't know I had, and I didn't give them a chance to show that they were allies. So I learned a lot, and it served me quite well throughout my career.
Well, for folks in the audience, I would say that is one of many powerful stories in Dr. Satcher's book, My Quest for Health Equity, that talk about the importance of individual action and collective action, and to your reflection, Dr. Satcher, about the importance of having partners and allies to drive that action forward, and to your call to action to us individually and us as a community to work together to reduce health inequities. We're signing up. You've been an extraordinary leader, colleague, a real blessing for me in my career to have had the opportunity to work with you and learn from you, and to have had the opportunity to have this really inspirational conversation this evening. It is just so great to see you and be with you again. And a very special thanks.
I feel the same way, by the way. It's just been great being with you.
Oh, I appreciate that. But a very special thanks to Beth and Mike Colson and Colson Oil for sponsoring our Bridge Builders conversations. You can keep up with future Bridge Builders conversations, as well as other exciting events at the Clinton Presidential Center at www.clintonpresidentialcenter.org/events. Thanks to everybody for joining us this evening. Enjoy the rest of your evening. Stay healthy and take good care. Good evening and thanks.
Okay.